Now, the last check, 22 people have died in Delta and 8 in Bauchi State as a result of the yellow fever outbreak. Today, the Enugu State government confirms strain deaths in 3 local government areas of the state. What's the true picture of the situation across the country?
Okay, thank you. I think last week we had official confirmation from the 3 states you've just mentioned. From Enugu State, we had updates of having lost 47 of their indigenes to the strange ailments. In Delta State, about 32 were reported. And in Bauchi, 8 cases of death were reported. And when you look at the cases in all these states, they are between the ages of 18 and 30 years maximum. Initially was reported as strange deaths, but following investigations, samples were taken from each of these locations and sent to Irua Specialist Hospital in Edo State. The initial result that has come out from those investigations have confirmed there were cases of yellow fever. Just for also satisfying global standard, these samples have also been further sent to Senegal, where the final confirmation will soon come. But with that, we know that we are dealing with cases of yellow fever in these 8 states. Thank you, over. In these 3 states.
So is it safe to say it's just 3 states that have cases of yellow fever for now?
For now, we are seeing in 3 states. But what is happening is that because Nigeria is within the tropical belt where we expect to see yellow fever, as a country, we had started planning for campaigns in these states because we have our children currently being given yellow fever vaccination to every child at the age of 9 months. Once they are due, is being given to them free of charge. That started about 9 years ago. The older age group were not involved in vaccination during their early childhood, and we know there are still a couple of Nigerians out there that have not yet received yellow fever vaccination. So we have planned for there are certain states we have seen within the belt that we know could be target areas where we have these diseases. Delta is one of those states that we've seen. Even the Bauchi that we're talking about, we're within the state we were targeting to immunize indigenes in those states that are from 9 months to 44 years. For the case in Delta, we actually plan to start a campaign on the 20th of this November. And that plan has been on before the COVID and was to be in June, was delayed to the November. But unfortunately, we had the incidence of those reported cases a few weeks back, and we have responded. We want to thank the Honorable Minister of Health, Dr. Ihanire, and the Executive Director of the agency, Dr. Faisal Shwe, because immediately we got the news 3 days after there was a response in the state Delta in particular. As we are talking, the 2 LGAs that are involved in it in Delta State, Ika Northeast, and then the Ika South that are neighboring one, have already, since the 10th of this month, we've started reactive vaccination in those LGAs. The remaining LGAs in those states, in that particular state, Delta State, will commence their vaccination on the 28th from the plan we have. Bauchi also, in the LGA that is involved, the Ganjuma LGA, we've started a response on the 12th of this month, and in Enugu, it started in Igbo, is a not local government, the area sharing boundary with Kogi State. As we're talking also on Friday, last Friday, there is a reactive campaign that have started in that LG. And we are also working with our partners to mobilize more vaccines to cover the entire state so that we don't have these unfortunate incidents happening again in these states.
I think that's a good way to end the conversation. Dr. Basi Oposin, a pleasure sharing your thoughts with us on the program.